Hello and welcome. This is Health Promotion Practices Author Interviews, and my name is Arden Castle. Each episode will explore a recently published article and its author. This week, I'm joined by Dr. Joseph Lee, author of Perceived Importance of Health Concerns Among Lesbian, Gay, Bisexual, and Transgender Adults in a National Probability-Based Phone Survey in 2017, which was published in February of 2020. This episode is focused on how his paper connects to the larger public health field, which is just one part of a three-part series with Dr. Joseph Lee. Tune into our other episodes to hear more about him and our other authors. So you've recently published 3 articles in Health Promotion Practice Journal in 2020, but you have a great body of work on smoking and sexual and gender minorities. First, in looking at your article titled Perceived Importance of Health Concerns Among Lesbian, Gay, Bisexual, and Transgender Adults in a National Probability-Based Phone Survey 2017, time has certainly passed between conceptualization and publication. So do you have any updates on your paper?
I don't think we have anything that has changed really. It's just remained important. That's my best way of saying that. It continues to be really important for folks to be thinking about what are the health topics that matter most to preventing premature death and disease for LGBT people.
Fair enough. And in looking at the bigger picture of SGM populations and tobacco use, where is the literature now? Has it moved forward? Were you really, breaking ground with your article? And where are the gaps in what's actionable?
Yeah, I think one of the things that's been most interesting to watch are we've really gotten a better sense of differences within our communities and been able to better see that in the literature. So there's been a lot of attention paid to the intersectional identities that exist within our communities and how that influences risk of tobacco use. So that's happening, and I think this is giving us a richer, better picture of what's happening in terms of health inequities for LGBT people around tobacco use. At the same time, I think the literature is really starting to also get better about thinking about what we do about this. So there is so much literature documenting health inequities, and it is so important from my perspective to really think about, well, we've documented them, but what is the underlying cause and what can we do to address these inequities? And I'm starting to, at least I feel like the literature is starting to get into those second 2 things better. And we're getting a better sense of risks and resiliencies that protect LGBT people from smoking or put them at greater risk for smoking. And we're seeing more interventions.
Excellent. And then do you have any goals for yourself and the field for maybe the next 5 years or the next 10 years?
I really want the field to understand better some of the gaps in utilization of evidence-based tobacco cessation programs. So we know LGBT people aren't using those cessation resources as much as we would want. And I really want to push the field to think about how we address that. The other thing I think is really interesting is our whole field is sort of based in a sort of a psychosocial stress perspective, where we think about discrimination and stigma causing basically a stress response for coping mechanisms. So greater stress, coping mechanisms leading to use and maintenance of tobacco products. But I'm really interested in the social norms side and the environmental side and the exposure to marketing side. And I think we haven't fully built out our understanding of those pieces of the LGBT tobacco use. And so I'm really excited to see what the next 5 years in this field bring on that side of things.
Interesting. And then do you see your research following any of those particular paths? I know that you have very diverse research interests, but do you see your research filling those gaps, or how do you see your role in the next 5 years?
What I kind of love about the field of LGBT tobacco prevention and control is that there's all these great folks across the country working on it. So you always you fit into this like sort of team, if you will. And we don't all even talk to we don't even know each other, all of us, but we all sort of, I always feel like we're kind of on this big team of people working on this. And so it's really neat to watch what they're doing. So I do hope that my research will get into more of how we promote the utilization of cessation resources and break down some of those barriers. And then I'd like to continue building out the other side around social norms and environmental exposures. Like LGBT people on average live in slightly more urban neighborhoods, and we live in neighborhoods that have slightly more tobacco retailers present on average. So like, what does that mean? Like, why is that? Is that the same across the country? Anyway, there's just lots of interesting things I think to do with trying to build our understanding of where this disparity or this inequity comes from.
Excellent. I love your new approach to sexual and gender minority tobacco use because their use is so nuanced and there are so many different ways to look at how and why and the reasons for tobacco use. And so I think that's going to be a very exciting and interesting change in direction for the field. In looking at the paper that you've just published, if someone wanted to teach your paper either in a classroom or use it as a guiding piece for maybe perhaps new research, what may that look like?
I think it fits into trying to develop sort of public health advocacy efforts and recognizing that you have to meet the community where it is, where we are. And so you can't just design an intervention to like build support for addressing a health problem when the community doesn't see it as a problem. So I hope that's where this could kind of be a nice starting spot for example, in a class about public health advocacy or about health communication, to really say, hey, this paper helps show us where folks are. Now, the question is, we need people to recognize the gravity of these health problems and these issues. How do we get from where we are now to where we want folks to be? And so you could use it basically in a program planning or intervention planning kind of framework to teach that, to connect those two pieces.
Yeah, I love that. And thinking about meeting people where they are and avoiding coming in as this top-down public health researcher, but really acknowledging where the community is and their beliefs about issues in their own community. As a mentor yourself, I know we're talking about, using this in a classroom, and we talked about this a little bit in one of our previous episodes, but you do a really good job of including your students in the research that you conduct. And I wanted to talk about the Mendez article and how you've involved students in your research and what that looks like as a professional, including students and helping them through the process, and what this looks like in terms of public health as a mentor.
Yeah, so for the paper you're talking about, we interviewed leaders in the LGBT communities across North Carolina about how they thought we should be talking about health inequities and like what the risks and rewards of how to talk about those were. Because one of the risks or worries is if you talk about health inequities, it kind of highlights a deficit or shows a problem, so it can be potentially stigmatizing. But we also want people to recognize the problem that's there so that politically we can do something about it. So it's this sort of double-edged kind of challenge. And my student did just a great job conducting the interviews, helping brainstorm the interview guide, talking through like what we really wanted to get out of this, collecting the data, and helping with the analysis and write-up of it. I'm just so proud of that paper. From my perspective, I love it when a student can sort of come in at the beginning and help brainstorm, starting with the research question, brainstorm that with me. Think through, if that's the research question, like what exactly do we need to know? Think about how do we measure that, or how do we get people to talk about that? And then take that out and implement that and have to deal with the messy challenge of collecting qualitative data, like keeping everyone's schedule straight, all the like detail pieces of that. And then the skills of doing interviews and like probing questions and like making sure you're not biasing folks and how they answer. So it really was a great experience, that paper, that I try to emulate in other projects with students.
And as a student myself, thank you for helping students be successful in the research world, because it can be very intimidating, although you have many research articles that have been published, and like you said, I think 14 with students on them. It takes a good quality mentor in order to really elevate these student voices and help them get through the publishing process. With that, do you have any parting thoughts on your work around tobacco use and SGM populations as they relate to COVID-19? Does this introduce any new concerns or action items for the future?
I mean, quite honestly, it just makes tobacco efforts even more important given the importance of lung health in fighting off COVID-19. So it's made it, I mean, it was already incredibly important, and it's just highlighted even more the importance of it, and highlighted the importance of investing in and planning for our public health systems to make sure that they're really well resourced and able to function really well under pressure.
Excellent. Well, thank you, Dr. Joseph Lee, so much for joining us today, and thank you all for listening in. If you'd like to find out more about our guest this week, you can reach him here. And as always, follow us on Twitter, LinkedIn, and Facebook for more author interviews. Thank you.